Well, thank you very much, and good afternoon, everybody. I was going to start off by making a few comments about cancer prevention and control, and really particularly looking at prevention, cancer prevention, and cancer early detection. And I'd like to do that with you from the perspective of public health practice, and I'll talk a little bit about some of the programs we have at CDC and in state and local governments, and some of the challenges we see facing those programs, and with some ideas of some things that the National Cancer Policy Forum might look at to help us chart our way as we move forward. I wanted to start off just with a word of thanks to the National Cancer Forum and the National Cancer Board prior to that. I think that you all have done some really excellent work that has in the past really helped those of us who are out in the practice side of things kind of chart our course. And we polled a number of studies that have been studies and reports that have been done by the forum and prior to that the board over the last decade or so, going all the way back to 2003, which was a sort of very broad look at cancer prevention and cancer early detection, and actually something that when I first started at CDC in 2009, a report that I found very helpful as I was looking at CDC's programs and where we wanted them to go in the future. So I'd like to thank you for that, and I will say there's a couple things on here that aren't the work of the forum, but they are IOM reports, and I'll talk about one of those a little more in a minute. So I wanted to talk a little bit about public health practice and some of the challenges that we're facing specifically around public health aspects related to cancer control. And I'm going to speak about CDC as one component of public health practice, but I did want to say there's the world of public health practice is made up by many partners. Physicians often are a key part of the practice of public health, non-governmental organizations, a lot of other governmental organizations besides CDC, academia, cancer centers. So there's a wide range of players in this. But I did want to talk a little bit about CDC's perspective, given the significant infrastructure we have, both through the federal government and through the state and local health departments that we work with. And so these are some of the basic health priorities at CDC. As you'll see, surveillance, epidemiology, and laboratory services are a very important part of the work we do on anything, and I think this is pertinent to cancer control as well. Improving the ability to support states, tribes, local, and territorial public health. That is how we do most of our work. Increasing global health impact and increasing policy impact. A lot of the most substantive changes we make related to public health are through policy changes. And we have a significant capacity across all of public health practice, but particularly through our state and local health departments. And one thing that I've learned a lot of people don't know about the Centers for Disease Control and the work we do in public health is that we do the majority of our work through state health departments, tribal health departments, and territorial health departments. When you look at our programs at CDC, which are cancer related, the specific cancer programs that have emblems at the bottom of the slide, and also if you include in that the Office of Smoking and Health and then the Division of Nutrition, Physical Activity, and Obesity, we're probably looking at about $500 million a year of funding, and 80% of that goes out the door to state health departments. So that is really where we do most of the work that we do in public health. And then those health departments contract out to a variety of local entities, local health departments, or in the case of many of the cancer programs, there's a direct relationship between a lot of the state health departments and clinical practice. And most of this has been built through some of the screening services that we've provided over the last 2 decades. So there's a real capacity there, and I think that capacity we built is something that's really facing some challenges. I use the slide because I think it's timely given that it's the end of baseball season. But this idea that things are coming at us fast, I think is probably a theme that all of the speakers today could have hit on. There's just an enormous amount going on, and there are a lot of challenges in the world of cancer control, but there are also tremendous opportunities, and clearly one of the big opportunities for all of us is in the Affordable Care Act and the environment of health reform that we're in. But this for us in public health has been an opportunity that is very challenging. It is, I think, that public health and public health practice are really struggling, not just in cancer control, but across much of the field of public health, are really struggling with what is the role of public health as we move forward, what is the role of public health in this new environment. And this is something that I hope that the Cancer Policy Forum can help us think through. There are a couple of ways that I think might be useful to think about how we go about doing this. The first is to look at the National Prevention Strategy. I think that this National Prevention Strategy provides a framework. It's a very broad framework, but a framework that it might be very useful to apply to the public health components of cancer prevention and cancer control. We actually did this a few months ago in a piece we wrote for the American Journal of Public Health looking at breast cancer screening and trying to think through what some of the future steps are for breast cancer screening. And I think that maybe taking that in a little broader perspective could be a very good way to think about how we frame and perhaps how the Cancer Policy Forum could frame some of the future functions and future opportunities for public health and public health practice. The other area that I think we really need some guidance and some additional expert opinion around is this issue of cancer screening and what is the role of public health in cancer screening. And I think you'll hear several of the panelists speak on this topic. But our perspective at CDC has been that for the last 2 decades, our role in cancer screening has been to pay for it for patients who don't have insurance. And as that changes, which we hope will be the case with the implementation of the Affordable Care Act, I think it really provides some opportunities about thinking about what some of the new roles will be for us. And as much as the Affordable Care Act and the availability of insurance for more people is going to be very, very important, we're actually about to release a report tomorrow looking at colon cancer screening, and one of the findings in that report is of people who are eligible for colon cancer screening who've never been screened, 75% of them actually have insurance, and 2/3 of them have a regular source of care. So, you know, a lot of what we said, I don't want to in any way diminish what I think increasing access to care and increasing access to a more organized healthcare system will bring. But clearly there are other barriers and other reasons that people don't participate, both in screening for cancer and also in many of the preventive modalities we have. So I'll end with a couple of areas that I think that you can help us, and by us I mean certainly Centers for Disease Control and our programs, but I think that some of these things I have to say are true for all of the various entities that work in public health practice. What is the role of public health in cancer screening? I mean, what is the role of public health in cancer prevention and control, period? But this issue of cancer screening is particularly difficult and perplexing for us right now, and something that I think that the forum could add some important input into. How can we ensure that healthcare and community efforts in cancer prevention are integrated and mutually reinforcing? This is a big challenge, this issue of what does the healthcare system do around cancer prevention and cancer early detection, and what is public health supposed to do? And how do we make sure that we are really serving the needs of populations and communities and not just serving the needs of individual populations within a practice setting? How do we measure and document the impact of public health activities in cancer prevention? You know, CDC having run a cancer screening program that pays for people to get screened for the last 2 decades has been very gratifying, and that is very easy to measure. It is a very tangible thing, how many people you pay for to get cancer screenings. And I think one of the reasons our programs have been very successful and our programs have been very popular with Congress is because we can count that up, and we have very tangible numbers. And as we start to perhaps move out of some of those functions, it's going to be very important that we can describe what it is that public health does that adds value, and that we can really measure that and provide outcomes that are compelling to policymakers and those who provide funding for some of these kinds of activities. And then finally, how do we move forward to fulfill the potential of cancer prevention and early detection? That is borrowing from the 2003 report that the Cancer Policy Forum did earlier. And I guess I'll close by saying that I think that one of the things that would really be helpful for us in public health practice is another report like that, another kind of comprehensive look at what are the challenges in prevention and cancer early detection, and what is the role for public health. Thank you.
Thank you. Thank you very much. Now I'd like to introduce Dr. Rachel Ballard-Barbash, who is Associate Director of the Applied Research Program in the Division of Cancer Prevention at the National Cancer Institute.